I'm Dr. Sri Banerjee, core faculty for the College of Health Sciences and Public Policy at Walden University. And in this segment, I'm going to be going over something that plagues women all across the world, but also in the United States. These are about 350 objectives that have been derived from the social determinants of health. And I find these more useful because these are goals. These are goals that are achievable or that we as a nation want to achieve about women. So, one of them is the reduction of pelvic inflammatory disease. And this is something that is on main diseases, on very common diseases like gonorrhea and things like that. If it's left untreated, can become pelvic inflammatory disease, and this can go all the way to causing sterility in women. So this is something that is required to take a look at. And what is interesting is that the status is improving between ages 15 to 24, but there's still some time to go before um, it can be called target reached. So there's a decrease desired. Um, so so that's kind of what the pelvic inflammatory disease is. And of course, you can click on these links to see what how much is needed to improve. So increase the proportion of sexually transmitted, sexually active female adolescents and young women who get screened for chlamydia. And this was actually in one of my papers where we were talking about, my co-authors and I were talking about chlamydia, and how this is not screened in women nor men sufficiently, and this needs to be policy from the United States Preventative Task Force to add in not only females but males, because males are oftentimes asymptomatic. Of course, reduce the syphilis rate in females. Well, that is getting worse. And then reducing congenital syphilis. And congenital syphilis can cause anything from blindness to many other diseases that are undesired. So there's a lot to go over. 105.8 cases of congenital syphilis per 100,000 since 2023, from 105.8 to 33.9. This is a huge sort of decrease that's very important to achieve. So, summary: untreated syphilis in pregnant women can cause miscarriage, stillbirth, and preterm birth. Babies born with syphilis are at high risk for physical and developmental delays, disabilities, and death. Screening all pregnant women for syphilis and providing early treatment for women with syphilis and their sexual partners during prenatal care can completely prevent congenital syphilis. So, this is syphilis, chlamydia, and a lot of different aspects are important to address when it comes to women's diseases. That's about it. I hope this has made some sense. Thank you for listening.